Well, thank you, Mr. Chair, and I want to thank you and the ranking member for having this hearing, and thank you, Secretary Azar, for being here. Look, I have some concerns about the HHS budget that I will get to in a minute, but I want to start with one area where we have some real common ground, which is ending surprise medical bills. Surprise medical bills happen, as you know, when patients receive unexpected and often massive bills, often for receiving care that they didn't realize was considered out of network. I've been working with a bipartisan group of senators to end this practice, including Senator Cassidy, Bennett, Young, and Carper from this committee. I understand that HHS is also interested in working on surprise medical billing, and some of our staff have already met with members of your team to discuss solutions to this issue. We appreciate those conversations. Will you commit to continue working with our bipartisan group of senators to address surprise medical billing?
Absolutely. We are deeply committed to solving this problem, and I appreciate your and Senator Cassidy's leadership.
Thank you. And can we also count on HHS to provide timely technical assistance as we finalize our legislative
Yes,
proposal?
absolutely.
Thank you for that commitment. I know I speak for our full working group when I say we look forward to finding a bipartisan solution to this issue. Now let's move on to the budget. I appreciate that this budget extends access to Medicaid for new mothers suffering from opioid use disorder and maintains funding for state opioid response grants, although we could really use more of that funding. Experts have said that it will cost hundreds of billions of dollars in sustained investment to address this crisis. How much do you think it will cost over the next 10 years?
In terms of the consequences of the opioid crisis?
Providing treatment and further prevention, recovery services, the kids who are affected, grand families.
You know, Senator, I want to do justice to such an important question. I couldn't give you an estimate of that. That we did propose the $4.8 billion, the continuation of our bipartisan work together in the budget. We prioritized
and I understand
I
that, right. And I'm going to move on. I don't mean to be rude, but time is limited because the real question is, do you really think that the funding in this budget is adequate to address the problem?
I do. I do believe that we're making progress, and on every measure we're making progress. It's going to be a long fight.
Well, and that gets me to my next point. We didn't get here to this point with this epidemic overnight. You and I have talked about that. It's going to take years of sustained investment to truly turn the tide of the epidemic. Moreover, while I appreciate, as I've just said, that there is funding specifically targeted toward combating the opioid crisis in this budget, the budget would also slash programs that are absolutely critical to fighting this crisis, as well as undermining critical health care services for millions of Americans, and thus harm our efforts to combat this crisis. So here's what this budget would do. It would lead to millions more being uninsured. It would cut and cap the traditional Medicaid program. And for people who aren't as familiar with that, not only does that impact an awful lot of people in nursing homes, it impacts some of our most vulnerable people who depend on Medicaid. And as we have a larger population of people who are surviving longer, happily, with very complex medical conditions, but who cannot work, that's really a devastating cut for them. And this budget would end Medicaid expansion, which experts on the front lines of the opioid crisis have said is the #1 tool at our disposal to combat the opioid epidemic. It certainly is in my state. In states that have expanded Medicaid, as we did on a bipartisan basis in New Hampshire when I was governor, hardworking people have better access to the health care, including substance use disorder treatment, that they need to live healthy, productive lives. In the last year, states across the country, including deeply conservative ones, have voted by referenda to authorize Medicaid expansion in their states. So why does this budget say to the millions of Americans who support Medicaid expansion, whose lives have been changed by Medicaid expansion, who voted for Medicaid expansion at the ballot box, why does this budget say to them, your voices don't matter?
So we replaced the Medicaid expansion with a new $1.2 trillion grant program to states to actually allow your state and others to custom design an insurance approach here that we think could allow a real focus on those populations that most need it, whether it's the traditional Medicaid populations of aged, disabled, pregnant women and children, those suffering from substance use disorder, as opposed to more the blunderbuss, give Medicaid to anybody who happens to meet an income threshold. You could actually allow a much more targeted, focused approach. That's our philosophy.
Yeah, and I have seen some examples of folks trying to do that have not worked. Medicaid expansion is working, and I just will finish up to Senator Brown's point. There are a lot of people who got Medicaid coverage who had lost their jobs, let's say, lost their health insurance coverage during the recession, then got sick because they couldn't get their medicine or couldn't get their treatment and they couldn't work. Medicaid expansion and coverage got them healthy again and they're back at work. And then they're moving off of Medicaid into the private insurance market, which is exactly the trajectory we want. I can tell you instance after instance in New Hampshire where being eligible for health care coverage when you're struggling and at some of the worst, most difficult times of your life has actually helped people back into the job market. The work requirements and this ending of Medicaid expansion is totally counterproductive to that. Thank you, Mr. Chair.
Senator Thune.